Our first presenter will be Dr. Deborah A. Gentile, noted allergist and immunologist, who has written extensively on air pollution's relation to asthma and the impact of that disease on our youth.
I'm not going to belabor this point, but it's very well known that air pollution causes a variety of health effects. Some of these are very short-term effects, such as trouble breathing, patients having asthma attacks, bronchitis, COPD, even patients with underlying heart disease having heart arrhythmias, heart attacks, those type of problems. There's also long-term problems that we know are caused by air pollution. Some of these are respiratory and cardiac as well, but we also know that there are many others, such as cancer and early morbidity or early death. These take decades to develop. Anyone who has chronic disease, chronic lung disease, chronic heart disease, even diabetes, they're going to be more vulnerable to the health effects of air pollution. Older adults, children, and pregnant women are all vulnerable populations. And then certainly people who exercise outdoors regularly, they're going to be breathing in during exercise a higher volume of air into their lungs and have more exposure that way. The pollution can actually cause these distal or further away effects in other organs. Basically, we're talking about very small, tiny particles of pollution. They're very small and you can't see them. You're breathing them in, and they're actually going down into your breathing tubes. And I like to think of the lungs as an upside down tree. So you have a long tube going down your airway and it starts to branch off. And then finally you end up in the leaves, or what we call the alveoli or air sacs. And the air sacs then are just separated from our blood vessels that feed the lungs just by a single cell membrane. So these small particles can actually cross from the air sacs and get into our bloodstream and go to all these distal or distant organs and cause these problems. Sometimes I'm asked why do we say the air is still dirty? It looks cleaner. Back in the heyday, decades ago, when the air looked dirty, those were much heavier particles. Those particles, when we breathe them in through our mouth and nose, those particles would get deposited in your upper airway. They would never make it down to your lungs. It's these small particles, the PM 2.5 that you can't see, that are causing these effects. So as far as asthma goes, we have 25 million US citizens with this. About 1 in 11 school-aged children have asthma. We spend over $80 billion a year on healthcare costs. And unfortunately, people still die of asthma. People forget this. We have over 3,500 deaths a year from asthma. And that's very hard to swallow for a specialist like me, because we're able to detect this disease and treat it. We can't cure it, but we can treat it and control it. Many miss school days, which I'll talk about a little bit later on. Adults with asthma are missing work. Parents of children are missing work. Many patients with asthma, if their disease isn't controlled, they're not physically active. And some people will say, well, what's the big deal? They can just take an inhaler and be better. We can't cure this disease. We can control it with certain medications, but those medications do have side effects. And I truly believe the best way to approach this is by primary prevention, trying to prevent a problem from starting. And this air pollution pyramid is true for all the different diseases that are caused and triggered by air pollution. We're going to start at the bottom, and there's going to be pollution exposure. So an example for asthma is that if I expose a patient to air pollution, the first thing that's going to happen is their lung function test is going to change. It's going to decrease. That can happen before they even start to cough or wheeze or feel like they have chest tightness. So that happens first. And then some of those patients are going to move on further and actually have symptoms. In my case, this would be asthma, the cough, the chest tightness, and wheezing, and they're going to reach for their rescue inhaler. Then what's going to happen is they're going to end up calling their doctor or their primary care provider, and they're either going to get a virtual visit or going to come in and see the doctor for an acute exacerbation. Then of those, some of them may have a bad exacerbation and end up needing to call an ambulance and going to the emergency room. And of those going to the emergency room, some are going to end up in the hospital. And unfortunately, again, some can die. And I don't expect you to master this slide, but the blue line on top is showing normal lung growth in a child. And they reach adulthood and it plateaus off. And then as we get older, we're going to start to lose lung function. That's what happens normally. In some patients with asthma, they actually have reduced lung growth. Their lungs are not going to grow to their full potential. And that's because there's inflammation in there, and that's causing scarring, and that prevents the lungs from obtaining their full potential. This first slide is from a publication that we had in the Journal of Asthma. It was published in 2020. We had studied 1,200 school children, most of which resided in the Mon Valley. All the children resided near point sources of air pollution. If your asthma is not controlled, you're going to be having frequent symptoms, wheezing, coughing, missing school, needing to go to the doctor. Your parents are going to be missing work. We actually teamed up with Dr. Albert Presto from Carnegie Mellon University, who has a mobile monitoring unit. And of those 1,200 students who participated in the study, he was actually able to tell us down to their home address what their annual pollution exposure was. 70% of the kids in this study had annual exposure to PM 2.5 above the World Health Organization limit at the time. And then subsequently, the World Health Organization has decreased that down to 5. Using our validated survey, we found that 22.5% of the children had asthma that had been diagnosed by a physician. The national, state, as well as the county rate of childhood asthma was 8 to 10%. And here we are finding 2 to 3 times the prevalence or the number of children who have asthma. And we found that 60% of the children who knew they had asthma had uncontrolled asthma. Again, meaning that they're sick, they're wheezing, coughing, missing school, they're not sleeping at night, parents are missing work, they're visiting doctors in emergency rooms. Based on state and national numbers, we expected 30% to have asthma that's not controlled. So again, double what you expected. We controlled for a variety of other factors that we know influence asthma, and they weren't playing a role in this case. These children near these point sources of pollution, their asthma outcomes were being driven by the air pollution exposure. This is a second study my group did. We published in 2021. When we were doing the school-based screening, and we're actually seeing how these children, how many children had asthma and how it was impacting them, we started some school-based clinics. And I was running a school-based clinic in the Clairton Elementary School at the time. We had come back from Christmas vacation to see the children for their January visit. This was the day we found out via the news that there had been a fire at the Clairton Coke Works on Christmas Eve. That fire had knocked out pollution control equipment. And that equipment was offline for months, almost 100 days. And I saw those children coming in January having asthma attacks and wheezing. And as a pediatric allergy asthma specialist, January is not a time when children flare with asthma. Their peak time to flare is typically in September when they go back to school. And then the other time they flare is April to May with the pollen exposure. So it was quite striking to see that this was happening with these children. That led us to do a large study. I teamed up with colleagues at Allegheny Health Network, and we were actually able to go through their visits, both outpatient visits to primary care doctors, urgent care or emergency department visits. We were able to look and see if there was an impact in the number of emergency room visits or outpatient visits. So these results are expressed as something called a risk ratio. What that tells us is how much more or less likely is something to happen in one group versus another. So in this case, it's how likely are you to have a visit for asthma if you were residing near the Clairton Coke Works facility before and then after the fire. And we focused on the zip code that the facility resides in. And what we found here, so if you're at 1, that means that the risk ratio is 1. That means the outpatient visits are exactly the same before and after. If we saw the ratio go down to 0.5, that would mean we cut the visits in half. If we see the ratio go up to 2, that means we doubled it. So what we found was that ratio increased to 1.82. So an 82% increase in all outpatient visits in that period after the fire. Emergency room visits, the same thing. We saw an 84% increase. We also broke it down just looking at increases based on pollution exceedance days. And you can see we had more than a doubling, a 2.5 times on high pollution days with PM 2.5 exceedances during that time frame after the fire as before. And then we saw similar trends in 1.58 and 1.7 with SO2 and H2S. So this clearly showed people were suffering. They were going to the emergency room, they were calling their doctor and going in for visits during this time frame, after the fire. More recently, we've done some work looking at school absenteeism in the Clairton School District. We actually obtained this data from the school, and we were interested to see if on higher pollution days were more children with asthma missing school. Again, a 1 means they're exactly the same. You're seeing about a 21% increase here in the number of school absences. That's not a high amount. That happens regularly there. That happens on quite a few days that we're seeing this type of air quality. If you look at the SO2, you saw the same type of thing. Sulfur dioxide is a component of PM 2.5. And if you have asthma and you're breathing in SO2 and air pollution, it actually causes an immediate bronchospasm or tightening of your breathing tubes. That happens immediately. PM 2.5 works a little bit differently. It causes inflammation or swelling, and then that swelling that happens causes a bronchospasm. So that often takes a day or even longer to develop. We also looked at more chronic exposure to PM 2.5, a 28-day daily average, and it was very similar. So the bottom line was we have a high prevalence of asthma in these school children, a high ratio of them having uncontrolled disease, and it's actually impacting their school attendance. And some people have asked me, what does this translate to? This translates to these children with asthma missing almost 2 more days per year. The school districts in general like children to only have 10 excused absences or less per year. And if their baseline starting at 6 to 7 days per year, as we were with this group, and they're adding another 1.7, that's getting them very close to where they've become concerned. And this is the summary. We have poor asthma outcomes in the Mon Valley, and it's associated with air pollution. It happens with both chronic as well as acute exposure. Again, this impacts a variety of different populations, children as well as adults. And then again, the newer thing here is that we found this impact on school attendance. Children who don't attend school on a regular basis are going to have difficulty learning, worse grades, and this could actually impact their ability to get post-secondary education or good employment. And then the other thing is they're missing that social aspect in exercise with sports if they're missing school. Again, I focused on asthma, and one of the reasons we focus on that is because we can measure some of these short-term effects. We don't have to wait decades for cancer to develop or for people to have premature death. But I just put this up here again to remind you, asthma is just one of these problems that are caused by air pollution. There's many, many more. And again, they're listed here. You know, I've been doing this now for 12 or 13 years. And, you know, it's surprising that we just want to focus on putting a Band-Aid on the problem. We know air pollution contributes to the development of asthma and asthma exacerbations. It's not enough to just give someone a medication that can cause side effects. We need to do more to prevent this problem. Yes, our air is getting cleaner, but we're still not at the updated standards that have been put in place recently by the EPA. We're finding as we expand these studies that we're finding and documenting that lower levels of air pollution than previously thought are causing these health effects. And we do have to make an effort to prevent this problem. And again, it's not just asthma, it's people who have all these other problems, COPD, heart disease, cancer, premature death. The other thing I'm always struck by within the county is that we have no effective real-time alert systems. When these patients are exposed to elevations of pollution, they need to remove themselves from that pollution as soon as they can. If we're not telling them there was a pollution spike until the next day, they've missed their opportunity to prevent an exacerbation. We have to be able to communicate to the media when these events happen. And then we have to have the media be able to broadcast this to everyone. Not everyone has a cell phone or the internet. Some of these patients are missing out. We need to do a better job at that.